Hi there, I'm Dr. Gawel from Indian Trail Animal Hospital. I'm going to talk to you a little bit more about cat diagnostic imaging today. So diagnostic imaging is using specific tools to look at and view areas of the body that we may not be able to see or feel with our physical examination alone. If you have any experience in human medicine, or unfortunately you've had some of these procedures performed on yourself, you are very familiar with the tools and equipment we use for our cats. They are the same that you would use in human medicine that we often carry over into veterinary medicine. What are those pieces of equipment? We're talking about radiographs or Xrays, the ultrasound machine, and then some of the more advanced techniques like a CT scan or an MRI. So when would we choose when to use a certain diagnostic imaging tool? Well, for example, if we have had your cat come in and he or she has been limping for a certain amount of time, or coughing, having difficulty breathing. Those are two great examples of when we would implement radiographs or X-rays. This taking pictures of the legs or extremities, we're going to look for breaks, dislocations, or problems, pattern changes within those bones. X-rays of the chest will allow us to look at the structure of the heart. What do the lungs look like? Do we see anything that is leading to heart disease, respiratory disease? The ultrasound probe is a little bit different. We look at very specific areas of the body and architecture of these organs, either inside the chest or the belly. So for example, if we're having heart problems, if there's an abnormal rhythm, an abnormal sound, we can put that ultrasound probe onto the chest and evaluate the heart valves, the muscles, the walls, and all those associated structures that give us an idea and diagnosis of heart disease. Same concept with the belly. If we've had a cat that has had, let's say, chronic digestive issues, vomiting, diarrhea, we can scan that belly and look at the architecture of the small intestine, of the liver, the kidneys, the pancreas, look for lymph node enlargement, any gland changes, again, helping us diagnose what that underlying problem might be with that kitty cat. Again, the more advanced diagnostics such as MRI and CT scan, those are usually require general anesthesia, but they're going to be even more specific to areas of the body like inside the spine, inside the brain, or if we have lumps or bumps that are seemingly so large, we want to see what associated structures are being affected. And again, they may be areas of the body that an X-ray or an ultrasound we just can't get to because it's protected by bone, thinking of the brain and thinking of the spine. So how do we decide? Well, which diagnostic imaging tool are we going to use next? Well, there's a variety of different ways we can come to this conclusion. We use our history. So that's things that you tell us about what's been going on, like I said, in the past 24 hours or even weeks, months with our cat's history. We use our physical exam, listening to heart and lungs, feeling around on the belly, looking at the skin and coat, all of these changes that tell us what's going on with this cat's health. Blood work, lab work comes into play as well. We can see and pinpoint a certain area inside the body or organ system that may be affected. Also will help us guide to what that next diagnostic imaging should be. Our ideal situation is to use these tools to make a diagnosis sooner and intervene either medically or surgically to prevent these kind of complications down the road. So whether we're talking about a mass or a tumor, a problem with a specific organ, or are we seeing heart disease? That'll help us implement a treatment plan to manage or cure these conditions to give you a healthy, happy kitty going on down the road. If you have any specific questions or concerns about cat diagnostic imaging, please contact us today at Indian Trail Animal.